Welcome to the IHH for Veteran weekly live stream. Here at IHH for Veteran, we specialize in assisting veterans with their physical and mental health transformation. This group addresses the unique challenges of veterans to improve their overall quality of life. The live stream this evening will be discussing medical marijuana and mental health. This is an article that was in MMJ Rex 12/30/23. In the ever-changing world of healthcare, we're diving deep into the exciting territory where medical cannabis and mental health come together. Medical marijuana is gaining attention for its potential in treating various mental health issues. Cannabinoids such as THC and CBD interact with the endocannabinoid system in the brain, influencing mood, stress response, and emotional regulation. For conditions like anxiety and PTSD, certain strains with higher CBD content may provide calming effects without the psychoactive properties associated with the THC. Additionally, individuals experiencing depression, insomnia, or chronic stress may explore strains that offer relaxation and mood-enhancing benefits. We want to unravel the potential benefits, tackle the challenges, and chat about the ethical stuff that pops up as medical marijuana steps in the mental health scene. So grab a seat, join the conversation, and let's explore where medical cannabis and mental health well-being meet, going over some of the most common mental health conditions and their potential treatment with medical marijuana. The endocannabinoid system and mental health. How does medical marijuana affect mood disorders and other mental health conditions? It all comes down to the endocannabinoid system. This system plays a crucial role in regulating various physiological processes, including mood, stress, and cognitive function, making it an integral target for understanding its impact on mental health. Comprising receptors as CBD1 and CBD2, endocannabinoids, and enzymes, the endocannabinoid system is involved in maintaining homeostasis in the body. Research suggests that the modulation of the endocannabinoid system may have therapeutic implications for mental health disorders, and in simple, such as using cannabis for stress relief. The endocannabinoids, such as anandamide and 2-AG, bind to CBD1 and CBD2 receptors in the brain, influencing neurotransmission release and neurocircuitry. This interaction has been linked to the regulation of stress response, anxiety, and depressive symptoms. Furthermore, cannabinoids derived from the cannabis plant, like CBD and THC, interact with the endocannabinoid system and have shown potential in alleviating symptoms associated with various mental health conditions. While this field is still evolving, understanding the intricate relationship between the endocannabinoid system and mental health holds promise for the development of novel therapeutic interventions. Medical marijuana for depression. The potential benefits of medical marijuana for depression have garnered attention, and researchers explore alternative treatments for this prevalent mental health condition. Some studies suggest that cannabinoids found in marijuana may exert antidepressant effects by modulating the endocannabinoid system and influencing neurotransmission activity in the brain. The MMJ is reported by some individuals to provide relief from symptoms of depression, including improved mood, reduced anxiety, and better sleep. Additionally, cannabinoids have anti-inflammatory properties, and there is evidence to suggest that inflammation may play a role in depression. Medical marijuana's potential to alleviate certain depressive symptoms has led to increased interest in its therapeutic use, especially for individuals who may not respond well to traditional antidepressant medications. However, it's important to note that individual responses to medical marijuana can vary, and more research is needed to establish its efficacy, optimal dosage, and long-term effects for depression treatment. CBD versus THC for depression, which is more effective? The effectiveness of CBD versus THC for depression is a topic that requires careful consideration of individual preferences and the specific symptoms experienced by those seeking relief. While both cannabinoids interact with the endocannabinoid system, they have distinct effects. CBD is non-psychoactive and is believed to have analytic and anti-inflammatory properties, potentially contributing to mood stabilization without the euphoric effects associated with THC. Some studies suggest that CBD may have antidepressant-like effects, making it an attractive option for those seeking relief from depression without the psychotropic side effects. On the other hand, the effects of THC on mood and emotional well-being may be strong in terms of enhancement, as THC is known for its psychoactive properties, but its intoxicating nature can be a concern for some individuals. The optimal choice between CBD and THC for depression may depend on individual preferences, tolerance for psychoactive effects, and the severity of symptoms. CBD oil for depression. The use of CBD oil for depression has gained attention as a potential therapeutic option. Many individuals report subjective improvements in mood and reduced anxiety with CBD oil use. However, it's important to note that research on CBD efficacy for depression is still evolving, and individual responses may vary. Medical marijuana for anxiety. The potential effects of using medical marijuana to treat anxiety have been a subject of interest and research. Some studies suggest that CBD may have analytic properties, meaning it can help relieve symptoms of anxiety. Medical marijuana users often report subjective improvements in mood, anxiety, relaxation, and a reduction in anxiety levels. CBD is particularly attractive in this context because it does not produce the psychoactive effects associated with THC. The potential benefits of medical marijuana for anxiety and cannabis for panic disorders also includes a potential to address symptoms that may not respond well to traditional medications. The best marijuana strains for anxiety and panic attacks can help to prevent these episodes in sufferers while allowing them to avoid the side effects of other medications. Can medical marijuana help with social anxiety? Medical marijuana has shown promise as a potential aid for social anxiety. The analytic properties of cannabinoids can help alleviate symptoms associated with social anxiety, such as the fear of being scrutinized, judged, or embarrassed. CBD influences neurotransmitter activity and can potentially reduce the exaggerated stress response linked to social situation. Some users report subjective improvements in anxiety levels and increased comfort in social settings with the use of MMJ. However, the effectiveness of medical marijuana for social anxiety can vary among individuals, and research in this area is still evolving. Medical marijuana for PTSD. Can medical marijuana help with PTSD symptoms? Research seems to indicate that it can. The endocannabinoid system plays a role in regulating stress responses and emotional memory. Some studies suggest that medical marijuana may help alleviate symptoms of PTSD, including intrusive thoughts, nightmares, and anxiety. THC, with its psychoactive properties, may aid in modulating fear responses, while CBD's analytic and anti-inflammatory effects can contribute to overall symptom relief. Many individuals with PTSD report subjective improvements in sleep quality, mood, and a reduction in hyperarousal symptoms with medical marijuana use. As research in this area continues, a better understanding of the efficacy and safety of medical marijuana for PTSD will likely emerge. Medical marijuana and bipolar disorder. The potential benefits of using medical marijuana to treat symptoms of bipolar disorder are a subject of interest. Though the evidence is limited and mixed, some studies suggest that cannabinoids can potentially help manage symptoms associated with bipolar disorder, such as mood swings and anxiety. However, the psychoactive effects of THC may pose a challenge, especially for individuals with bipolar disorder who are sensitive to alterations in mood. Furthermore, the impact of long-term marijuana use on the course of bipolar disorder is not well understood, and there are concerns about potential adverse effects in interaction with mood-stabilizing medications. As with any mental health conditions, it's crucial for individuals with bipolar disorder to consult with healthcare professionals to assess the risk and benefits of using medical marijuana, explore alternative treatments, and develop a comprehensive and personalized treatment plan. Cannabis and schizophrenia. The potential benefits of using medical cannabis to treat symptoms of schizophrenia are a complex and debated topic within the scientific community. While some studies suggest that certain cannabinoids may have antipsychotic properties and could potentially alleviate some symptoms associated with schizophrenia, the overall evidence remains inconclusive and limited. The psychoactive effects of THC also raise concerns about potential exacerbation of psychotic symptoms. Also, individuals with schizophrenia may be more vulnerable to the adverse effects of marijuana, including cognitive impairment and increased risk of relapse. Given the complexity of schizophrenia and the potential impact of marijuana on psychotic symptoms, it's essential for individuals with schizophrenia to consult with medical health professionals before considering medical cannabis. Cannabis and insomnia. The potential benefits of using MMJ to treat insomnia have been a focus of interest due to the plant's known sedative effects. Since the endocannabinoid system plays a role in regulating sleep-wake cycles, some studies suggest that medical cannabis, particularly strains with higher levels of CBD, may help individuals struggling with insomnia by promoting relaxation and reducing stress. THC, with its sedative properties, may also contribute to improved sleep onset. Many individuals report subjective improvement in sleep duration and quality with the use of medical marijuana. Medical marijuana for ADHD. The potential benefits of using medical cannabis to treat ADHD, attention deficit hyperactivity disorder, symptoms are a subject of interest. Although the evidence is limited and mixed, some individuals with ADHD report subjective improvement in focus, attention, impulsivity with the use of MMJ, likely because the endocannabinoid system plays a role in regulating attention and cognitive functions. While some studies suggest that certain cannabinoids may have neuroprotective and cognitive enhancing properties, the psychoactive effects of THC and the variability in individual responses raise concerns about the suitability of medical marijuana as a consistent and standardized treatment of ADHD. Furthermore, the impact of long-term MMJ use on cognitive development, especially in younger individuals with ADHD, is not yet well understood. Benefits of medical marijuana for chronic stress management. The potential benefits of medical marijuana for chronic stress management have gained attention as researchers explore alternative approaches to alleviate the adverse effects of prolonged stress. The endocannabinoid system plays a crucial role in stress regulation, and as we've mentioned, some studies suggest that cannabinoids may have analytic and stress-reducing properties, influencing neurotransmitter activity and mitigating the physiological responses associated with chronic stress. Individuals using MMJ often report subjective improvements in mood, relaxation, and an overall sense of well-being. CBD in particular is valued for its calming effects without the psychoactive properties associated with THC. Using CBD for stress and relaxation seems to be an effective alternative treatment. However, as with all other mental health conditions, individual responses and efficacy may vary. Marijuana and mental health medications, interactions, and considerations. The interaction between marijuana and mental health medications is a complex area and requires careful consideration. THC and CBD can interact with the same metabolic pathways in the liver as many medications. This interaction may influence the metabolism of certain drugs, leading to changes in their effectiveness or side effects. It is essential for individuals using mental health medications to be aware of potential interactions to ensure the safety and efficacy of their treatment. For individuals taking antidepressants or anxiolytics, the interaction between marijuana and these medications is of particular concern. Both substances can affect serotonin levels in the brain, and combining them may lead to an increased risk of side effects such as drowsiness, dizziness, or an exacerbation of depressive symptoms. Additionally, THC can have psychotropic effects that may interact the therapeutic benefits of certain medications. In the case of antipsychotic medications, there is a need for caution as well. THC, with its psychoactive properties, may potentially worsen psychotic symptoms or interfere with the efficacy of antipsychotic drugs. Conversely, some research suggests that CBD may have antipsychotic properties, but more studies are needed to fully understand its impact and how it may interact with existing medications. Individual responses to marijuana and mental health medications can vary, and it's crucial for individuals to communicate openly with their healthcare providers. Patients should disclose their marijuana use, including the frequency and method of consumption, to ensure that healthcare professionals can make informed decisions about medication management. In some cases, adjustments to medication dosage or alteration treatment approaches may be necessary. Ultimately, the complex interplay between marijuana and mental health medication underscores the importance of personalized care and ongoing communication between patients and healthcare providers. Before making any changes to your treatment plan, individuals should consult with their healthcare professionals to ensure they receive comprehensive and tailored guidance based on their specific mental health needs and the medications they're taking. The relationship between cannabis and emotional well-being is a multifaceted tapestry that requires careful exploration and consideration. Whether grappling with social anxiety, seeking relief from depression, or managing chronic stress, individuals must approach cannabis with an informed and nuanced perspective. By leveraging personal experience, scientific insights, and ongoing research updates, individuals can make decisions that align with their unique emotional health needs. It's also crucial to engage in open communication with healthcare professionals to ensure a comprehensive and personalized approach to mental health well-being. To schedule a complimentary assessment, go to my website, veteransvictories.org. Thank you and good evening.